Hi, this is Bob Boross, and you're watching my Jazz and Tap Dance Life. This is my YouTube channel based on all things jazz and tap and all the things that I've done in my now 48-year career of teaching, choreographing, and being active in the field of jazz and tap dance, musical theater, and many other forms of dance. Right now, we're giving you an update on where I am. As you may have known if you watch my past videos, dealing with some severe knee problems, a knee replacement that actually went bad on me, developed an infection, and we had to deal with that. Very luckily, I ended up going to the hospital of special surgery in New York City. And the doctor there that I have, Dr. Wo Chin Lee, he's the one who found the infection right off the bat, whereas my original doctor was not sensing that there was a problem there. So what they gave me at that point is the progress that I was going to have was that I needed 2 knee operations. First, to do a temporary knee replacement. That way they could try to clean out all of the infection. And then I would be taking antibiotics for 4 to 6 weeks. Once that's cleared out, then after that, they go back in and they do the knee replacement all over again, but this time with the permanent. So two knee replacement operations. So that was what the prognosis, and this is where I'm at now. I had the first operation on December the 14th. So it's been about 3 weeks now since then. So the operation went well, went fine. They kind of gave me the idea, well, you go home the day after, maybe 2 days after, something like that. Well, I ended up staying in the hospital for 5 days. And there's a couple of things that they just didn't tell me about that's part of this. Number one is this thing right here. I have to have daily infusions of antibiotics to treat the bacterial infection that I have. So they inserted this in my arm, which is called a PICC line, P-I-C-C. So I actually have a plastic tube that was inserted into my arm, deep into the vein, and then actually the tube goes down towards your heart. So with this little cap, once a day, I have it set up with a couple of saline flushes and then the antibiotics in the syringe. We take this off and I insert all of it. The whole thing takes about, I don't know, 12 minutes or so. No pain whatsoever. The only pain was them inserting this in deep. Let me tell you, that hurt. And that process took about an hour. So I had to deal with that. So they didn't tell me about that. And as part of dealing with this, getting it in and getting the people set up to send me the antibiotics, that's what took 5 days. So I was in the hospital much longer than I thought I was going to be. Another thing I'm dealing with, which they didn't tell me, is that I had to keep my knee absolutely straight for almost 3 weeks. So I have a big Velcro brace, which you'll see here, that's been on my leg for 3 weeks, and it's called the immobilizer, which it really does. You just cannot move your leg. And it was a little bit hard, to do sleeping, things like that. Of course, you certainly can't take a shower. I'm doing a lot of sponge baths, things like that. But now I did go back to see my doctor, Dr. Lee, just this past Tuesday on January the 2nd for a follow-up. Everything looks good. He said the operation went well, x-rays look fine. Actually, I'll show you a little picture here. This was like right after the nurse who came to my home after 2 weeks after the operation took off the bandage, so you could see the sutures here. But Dr. Lee was, pretty brief. He just said, everything looks good. We'll do the antibiotics. That will be cleared up. I actually have a different doctor who's dealing with the bacterial infection. He's the infectious disease doctor, Dr. Miller. And he monitors my weekly blood tests, and we'll keep an eye on that. And for my last blood test, which was just a couple days ago, but got the results already, at least positive to me, because initially my white blood cell count was like astronomical. The high was supposed to be up to 2,000 and mine was 34,000. Yeah, so there's definitely an infection there. Now, after this last one, just 2 days ago, we got the results back. My white blood cell count is actually within the normal range. So hopefully that means that this is all working. The infection is getting killed off, and I'm well on the way to the recovery that I need. So I go back in 6 weeks to see Dr. Lee again, just to see how we're doing. And by that time, this should be gone, this PICC line, thank God. And Then he set up the operation for the second one, which will be the middle to the end of March, he said, and we'll do that there. So anyway, that's where I'm at right now. I'm now off of the immobilizer most of the time. I'm getting around a little bit more. I'm doing the daily infusions into my arm and basically just walking, because as Dr. Lee said, this is only temporary. You do not stress the knee. You do not work it hard. Basically, you walk. You can walk. So that's what I get to do for the next, well, for a total of 3 months by the time I get the next knee. And then I'll have another 6 to 8 weeks of recovery and recuperation. And maybe by then, I'll feel a little bit more up to it. So my goal, I guess right for now, is by the summertime, hopefully my knee is good. I can move around a little bit, get a little bit more in shape dance-wise, and maybe start teaching again in September. So that's the goal. Hopefully my right knee, which is the other knee, I had a partial replacement in there just a little over a year ago. That's still giving me a little bit of pain. And I think that it's more soft tissue than an actual problem in the joint. So anyway, that's all got to be looked at too. So anyway, we talk about, my jazz and tap dance life. I've been doing this for 48 years now. 48 years. I've been involved in this in one way or another, but very strongly dancing all the time, always on my feet. So this is what you get. Your joints wear out. You have problems like this. So between my knees, the bone spurs I had on my toes, my lower back, my neck, other things that go on too, which actually really aren't like body wise, but other things that you have to deal with. So it's all part of that process. And so right now, my goal is just to keep my body in shape, to keep it going and not overstress it, not do anything crazy and make something hurt even more than it is. So anyway, that's where we're at now. So thanks for tuning in. I will keep you abreast as to where I'm at once we get to the next doctor's visit in 6 weeks. But it's getting better. It's looking up. I kind of turned the corner. I got that first operation down. Now we're looking towards the second one, and we'll go from there. Okay. So thanks for tuning in. Again, my name is Bob Boross. This is my jazz and tap dance life. Thanks for watching, and I will be back soon as soon as I know more information about what's going on. Okay. Thanks and take care.